Eva, I'm so happy that you could be here today to have a discussion around postpartum and mental health. When you and I first met, we talked a lot about the intersection between nutrition and our mental health. And you really blew me away, kind of talking about all the different ways postpartum can present itself. And I think one thing that happens often is that I will tell someone I have a functional snack brand. We create these support snacks. And our first collection is for postpartum healing and recovery. And the reaction is like, postpartum? Well, I don't have postpartum. When the reality is, we all go through postpartum. If you've had a child, you've gone through postpartum. It's a stage of life. So you really eloquently kind of described what that looks like. So I'm so happy that we could take some time to talk about that today. So would love for you to introduce yourself to the Mamala Land community, and just tell us a little bit about who you are, a little bit about your practice, and then we can kind of dive into what is postpartum and kind of how it can look.
So I'm so excited to be here. I'm a social worker with a therapy background. I am part of a practice called CBT of Central and South Florida, and I specialize in seeing adults with anxiety, OCD, also chronic health issues. But one of my main specialties is perinatal mental health. So I do support a lot of women and birthing moms through pregnancy, postpartum, that do find themselves feeling a lot more anxious, maybe some mood swings, difficulty with the adjustment, right? That, many of us don't anticipate during that time, right? I myself was in like the research world for anxiety for a number of years, and I never even knew that perinatal mental health entails anxiety. All we hear, right, is postpartum depression. And I think a lot of moms hold that stigma, right? Because it's looked at in a very negative light, right? If you are feeling sad, if you're feeling hopeless, if you're not connecting to your baby, I must be a bad mom. A lot of us kind of distance ourselves from that. Like, no, I don't have that, right? I'm, I'm okay. I'm not going to be a danger to my baby, right? But perinatal mental health really encompasses so much. And even amongst providers, there's a lot of misinformation, right? So we are actually looking at a stage from the time that parents are trying to conceive, okay, through pregnancy and postpartum, which formally right now we recognize it as within the first year, but there's a push to expand that past the second year postpartum. But those that specialize in this field, we do know that if there's certain emotional disorders that are not addressed during that time, it could really last longer. There's times where I'm seeing clients that their kids are in middle school and their symptoms started after they gave birth, whether it was anxiety or OCD, and they're just seeking care now. And we realized that was the onset. That's when it all started. All right. So it is a pleasure to be here to be able to discuss this topic. I'm very passionate about it as a mom myself. Where should we start? We
Well,
should
one thing that in the early, we ran a kind of like taboo topics and let people write in about things that came up for them, especially kind of and I don't know if this is a clinical term, but I always kind of refer to my like fourth trimester as like acute postpartum. And something that came up among so many women in the DMs was intrusive thoughts. And because when I talk to women, I know how common intrusive thoughts are because once you start talking about it, people come out of the woodwork and they're like, "Oh my God, I never told anyone about that." And that was something that like I was dealing with, during multiple pregnancies. And so when you and I spoke about intrusive thoughts, I didn't realize the correlation between intrusive thoughts um, and other conditions. So I'd love for you to talk a little bit about that.
It surprised me when I became a mom myself, right? So for anybody that doesn't know, intrusive thoughts typically mean thoughts that come up that they're recurrent. So they're happening again and again. They're typically unwanted and they cause a lot of distress. What we see in new parents, and I'm actually talking about moms, dads, sometimes even adoptive parents, sometimes even grandparents, if they're very involved in caregiving, there's a high prevalence of what we call these intrusive thoughts. For a lot of people, the theme is harm, right? So because a new baby um, arrives, there's like a heightened sense of responsibility, right? We've maybe taken care of plants before, maybe we've taken care of our pets before, but this is survival. You're trying to keep this infant alive. And so our brain is now biologically wired, right, to take on this enormous responsibility. So it starts to also backfire on us because it starts sending us, our brain sends us a lot of false alarms. So before we know it, we might be in this acute postpartum period that you're mentioning and even beyond. And we start having these thoughts, sometimes images, right, of something really wrong happening, right? It could be going down the stairs holding your baby, and all of a sudden you have the image of like, what if I trip and fall and my baby gets hurt? And I know it sounds gruesome, but what if like their head breaks open, right? What if I'm giving them a bath and I get distracted for a second and they drown, right? Or what if I'm driving in my car, right? And this is so common and I accidentally swerve and hit another car and we all die, right? So they're really catastrophic in nature, okay? And because we love our babies, our kids are the most precious thing in the world to us, these thoughts and images that arise, they feel really threatening, they feel really real. So you might even have a strong visceral response in the moment. You might start crying, you might start having a panic attack, okay? Um, and sometimes our brain does not realize that has not happened yet, right? It's not what's currently happening in our world around us, but it is our brain generating, almost trying to protect us by thinking ahead, but it's overdoing it, right? To the point where it can be very debilitating. So the prevalence of this is really high in general for the perinatal period. The research says that somewhere between 80 to 90% of new moms have intrusive thoughts. I think for dads, the statistic is closer to 60%, but it could be slightly off. So they're very common because you are trying to keep your baby alive, right? And so you're more likely to think that way, to think ahead, be protective. We're evolutionarily wired, right, to have these thoughts. But then it can cross over to new territory into something called perinatal OCD. So perinatal OCD is really rarely talked about, I think, amongst, you know, moms, friends, communities, and honestly, even within the mental health field itself. I think it's often under-recognized and underdiagnosed. What tends to happen is these same type of intrusive thoughts then lead to certain actions or behaviors to try to neutralize or get rid or fix this anxiety, right? Because these thoughts are scary. And so what happens if you have an intrusive thought of accidentally getting into a car accident, right? And maybe your kid's dying or the whole family dying. And then that leads to you avoiding driving altogether or avoiding certain roads where you had these thoughts come up. Or now someone else has to be in the driver's seat, right? That's avoidance. And while the behavior makes sense, right? You're thinking like, how do I reduce the risk of something like this happening? Avoidance is something that actually really feeds OCD. So the more we avoid those like themes of these thoughts and images that come up for OCD, the more that OCD is gonna grow and get bigger, right? Another example, let's say, if you're having like thoughts around contamination, which can pop up in perinatal OCD, you might start to think, I can only nurse or breastfeed. Because if I introduce formula to my baby, what if there is some toxin in there and then they get really sick? And then it's more than just anxiety, right? Anxiety would look like, you know what? I'm really worried. I want to do the best thing for my baby. I hear this is, you know, that, breast milk is really healthy. I really rather go that route, right? Or that's just being, an informed, making the best informed decisions that you can as a parent with the resources and access that you have. OCD really, the way we start to notice that it's happening is that it really kind of goes way beyond that. So we start to have thoughts and images of what if, the bottle of formula is contaminated? What if my baby then stops breathing? What if they get some like health catastrophe and they end up in the hospital and they end up dying, right? So these types of thoughts and images go to typically like really worst case scenarios. What typically happens is that we can't actually say to someone, no, that will never happen, right? Because we don't know. We don't have a crystal ball. There is a risk of something, there is just risk, right, with being alive. And so OCD really holds on to that because there's uncertainty,
So
right?
what ends up happening?
So, a mom or dad that might experience OCD, they might engage in more compulsions or rituals, which is what we call reassurance seeking, right? So you're asking your partner or your doctor or a grandparent, someone else in the support system over and over whether their baby is going to be okay or if what they're doing is correct. They might mentally reassure themselves over and over, it's fine, it's safe, we're going to be okay. They might check on the baby constantly, right? And it's never enough, right? They might check the baby's vital signs. They might wake up in the middle of the night, make sure the baby's breathing. When they're
Do you
feeding,
think,
they'll
I'm sorry to interrupt, but do you think that some of like the wearable devices that are available now to new moms to that go around the baby's chest or that go, a little sock on the foot that's monitoring their heart rates, do you think that those are beneficial or do you think it feeds into these patterns of OCD?
Excellent question, right? We have this incredible technology, and we have, I have heard, right, a few stories of it like truly making a difference, and that's incredible. But it also runs the risk of feeding something in new parents when there's already a heightened risk to think the worst case scenarios, to make you more prone to check and be hyper vigilant, impact your own mental health, okay? While the risk of something happening or going wrong is low, right? So we want to look into like, what is your history with anxiety, right? Are you currently diagnosed with OCD or do you have a history with OCD? Because you might be more prone to fall into a trap, right? And then we're seeing parents stay up all night. We used to be watching the monitor, but now we're watching this more like advanced technology to monitor the baby's vitals. Um, and it creates so much anxiety and hypervigilance. And someone might say, yes, but isn't it worth it? Right? Because you're kind of protecting your baby. And we really have to weigh that. There's no exact answer for each person. Everybody will vary, right? But if you're not sleeping at all during the night, right? Like really experiencing sleep deprivation, and then you're experiencing more intrusive thoughts the next day, mood swings, irritability, you can't eat because you're
All
nauseous,
because
how
of the
anxious you are.
all because of like things are compounding. It's like
Exactly.
the sleep deprivation, the lack of eating, the and that is compounding, leading to increased occurrence of intrusive thoughts, and then it kind of spirals from there.
Exactly.
Are
Exactly.
there any and if you don't feel comfortable saying it's totally fine, are there any ways of like kind of tried and true things to do when an intrusive thought comes in that can put you in a better position to protect yourself from kind of like falling down the OCD rabbit hole, if you will?
Yeah. No, it's an excellent question, right? So, in an ideal world, right, we're able to increase awareness about what this is. If you're seeing a therapist already, or if you're thinking about seeing a therapist, I would look for one that has experience with OCD, and they can do either exposure and response prevention. Another skill set that they can provide is something called acceptance and commitment therapy. Okay. And there's also a newer form of treatment for OCD. I'm less informed about it myself and haven't received training. It's called ICVT, inference-based CBT, but I myself can't speak to that yet. I know it's growing in research, but it's not yet the gold standard. The gold standard is exposure and response prevention. So if you're recognizing that this is coming up for you, a really important tool is being able to call it out, right? Give it a name. Recognize this is not me, this is harm OCD, or these are intrusive thoughts. And sometimes by labeling your experience, you have a lot more power because by giving it a name, you reduce the severity of the emotions around it. Okay. It can also create a little bit of time to pause and say, what response, right, do I want to engage in here? Because we're going to have two options: responding in the way that feeds the OCD by doing compulsions, engaging in avoidance, doing rituals, or if we have enough space to pause, we can say, I'm going to respond to these thoughts differently. Okay. So after you name it and label it, as much as possible, we want to recognize, you can do some skills to increase your awareness of the present moment, right? So by recognizing this hasn't happened yet, maybe it could happen, maybe not, and I know that feels terrible. We want to actually anchor ourselves in the present moment, okay? And you can even ask yourself, what are behaviors and actions that align with my values and goals, right? Because OCD can really rob you of that.
It's very interesting, and I'll just share a small anecdote. And I think I shared this with you when we first spoke. When I had my first, it was very, very hard to even leave the house, to leave her alone. And my mother-in-law was a labor and delivery nurse for 40 years. So if I was going to leave her with anyone and like feel comfortable about it, it would be my mother-in-law. And I remember it was maybe like the second or third time that she had visited us, and I was getting more comfortable, but still like super anxious. And anytime I would leave her with somebody, I would have to say, be safe, like make sure to be safe, make sure to be safe, make sure to be safe. And then I would always have to review the choking procedure for an infant. And I remember how you'd have to do it if God forbid she choked. You have to do this. Um, and I it was so it was like the third or fourth time that my mother-in-law visited, and I was doing like the be safe ritual, and she she basically looked at me and said, "Cut it out." She was like, "You don't need to tell me to be safe." And
Right.
I was really offended by it, and I was like, "Who the hell is she?" But you know what? It was kind of like this like rubber band snap moment of like, oh, like she's right. I actually don't need to do that. This magical thinking around me doing these things is like not changing anything. And it's like one of those moments that I look back on that like really stuck with me, that I'm like, huh, so interesting how like that was like the thing that I needed.
Yeah. No, it's
And
fast.
I love therapy. But besides that, there was that interesting thing that transpired between us.
It is fascinating because it shows up a little bit differently for everybody, right? But of course, you're going to be worried, right? You're a first-time mom. It can feel so scary to leave your baby with anybody else, even if they're the most credentialed person or people in your family that you normally trust. I think all of a sudden our nervous system gets so dysregulated and we start thinking worst case scenarios, and there isn't enough reassurance in the world that will make us feel safe and secure, right? So I do think working with the perinatal population when it comes to OCD and intrusive thoughts, I think there's a certain sensitivity that is needed, that is required more so than when you're working with like general OCD in the general population, right? Because when you're postpartum, it can feel like biologically you're so connected to your baby, right? I remember when my baby as an infant was crying, like you would feel it, right?
It's
Even as a
leaking.
nursing
Yeah.
mom, you'd start leaking. It really is a very different, in my opinion, situation than general OCD because you're also undergoing a significant physical recovery after birthing. You know, some people get C-sections. You know, you're going through major surgery or a significant trauma in your body, and who knows, right? Also, what the birthing experience was. If there was birth trauma or separation, time in the NICU, if there was something during the birth that made you feel unsafe, right? That also puts us at a heightened risk to have emotional disorders in the perinatal period and can increase that risk of being really vigilant about your baby's well-being, right? So
What
that's
you shared like a really crazy statistic with me when we first spoke, and I can't remember if it was about the occurrence of OCD in the perinatal population or if it was PTSD.
so likely the OCD, we know that for the perinatal population, I think it's like 2 to 3% of the population ends up having that diagnosis. And there's also a specific study that says that in a sample of new moms that had perinatal OCD, 1/3 of them, the first time that it occurred, so the onset happened during the perinatal period. So 1/3 of that sample, like did not have OCD before. Okay, so we're looking at during this transitional time, right? The sleep deprivation, the significant role shift, the difficulty in meeting any other need, right? And here we're going to talk about like the nutritional needs that play a role in, increase our risk, right, for emotional disorders here. Um, all of that makes us more vulnerable to OCD, especially that heightened responsibility as well of a new baby. Right. So the fact that in 1/3 of the cases, someone did not have OCD before becoming a mom is pretty telling, right?
Wow, that's an unbelievable statistic. Um, let's talk a little bit about the screening process because that's something that you and I are both just in dismay over. And a big part of building Mamla has been developing relationships with pediatricians because I always say the first person to really check in on me and my well-being was my children's pediatrician. The first person to say, "Are you okay?" 100% seem okay. And what that looked like for me was real postpartum nutrient depletion, postpartum anxiety. And if it wasn't for them, it would have been a much darker situation. Making sure, Rebecca, you really need to be eating a certain way. You really need to be taking care of yourself. You need to be acknowledging what's going on. So, you go and see your doctor, your OBGYN, like at your 6 week checkup. You get this sheet of paper. Tell us your thoughts on it.
I think you were incredibly lucky if your pediatrician checked in and really saw you and what was going on for you and said you might not be okay, right? Let's address this. I think that is not the norm, unfortunately, right? When I gave birth, the protocol was seeing your OBGYN 6 weeks after having a baby. And those 6 weeks, so much happens then when you have no idea what's normal, what's not normal. Again, we all come with this idea that the perinatal period will, we're looking out for the baby blues, we're looking out for depression, but there is so much more, right? If you're feeling like you're in constant fight or flight, right? If you're the level of overwhelm is so high, right? There's more going on, right, than the baby blues. The baby blues, really, we're looking at only the first 2 weeks postpartum, when we expect some hormonal fluctuations. Anything past 2 weeks, we have to screen for emotional disorders like anxiety and depression. Okay. What we typically see is a very brief screener, typically something called the Edinburgh like depression scale, that asks a few preliminary questions if someone is experiencing mostly postpartum depression. Maybe it screens a little bit about postpartum anxiety. But the way these things are done are also super important. I think I shared with you when I had my first baby, I went in for my 6 week visit already feeling super overwhelmed. I was not feeling down or depressed, I was anxious as well. And then I think it was the nurse or midwife hands me the screener. She says, "This is for you, mom, but you're not depressed, right?" And think about like that as a no, the first, place where you could potentially get support, and it was shut down. Anybody that was feeling depressed, who would feel like comfortable enough opening up after that? And I think the questions are not broad enough to encapsulate like the fact that anxiety during this period is even more prevalent than depression. So seeing the pediatrician, I think it's excellent to partner up with pediatricians, because yes, they will see you 2 to 3 days after the baby's born. And, of course, a lot of the focus is on the baby, but having these types of conversations hopefully can increase the likelihood that pediatricians are also looking out for moms.
And to double click on, what else can be going on for someone during this postpartum period. You mentioned, obviously, we talked about OCD, anxiety, depression. We didn't really talk about PTSD, which is also, it comes with not only a lot of traumatic births, but you're dealing with flashbacks, you're dealing with really like a lot of unresolved issues. What other things can come into play during postpartum that we may not consider?
So aside from like birth trauma, right? Like, and that in and of itself can be really debilitating, right? We are looking at nightmares, flashbacks, difficulty with separation, difficulty with connecting sometimes with your baby as well. We also see a lot of difficulty, like if there's a partner in the picture, right? We tend to see like a breakdown of communication during that time. I think the dynamic between partners really shifts after the baby comes into the picture. Um, so that is something that also adds to the load of stress going on, right? When again, the priority becomes the baby, I think the couple, the partnership gets deprioritized, and that can cause like a longer term stressor. And then it can become difficult to also engage a partner to help a mom if they need support because of the anxiety or depression. Um, there are other things that can occur in terms of like when we talk about perinatal mood and anxiety disorders. Um, Sometimes we see perinatal psychosis, postpartum psychosis, which can feel really scary. That often happens because of the extreme sleep deprivation and hormonal shifts. Unfortunately, those are oftentimes more of the stories we hear in the news, right? When there's harm to the mom that happens or harm to the baby. And those are considered medical emergencies. So, actually, for providers that don't have this training, sometimes they can confuse OCD with psychosis, and there's a lot of misdiagnosis. So, we see, unfortunately, a lot of new moms either maybe being sent to inpatient because they have OCD, but the provider had no idea and thought it was an episode of psychosis, right? So, provider training is really important. Does that make sense?
That makes total sense. So if you were to talk to any of your friends, and I know that you talk to many of your friends as they're going through postpartum, and as you kind of went through your whole, as we're still going through matrescence, where do you think the best place to start is right after you have a baby? What do you think we should be kind of stacking ourselves with, besides like covering the having a freezer full of food and making sure that you have your support snacks, aside from all those things in terms of like nourishing mom, nourishing her body, making sure that someone's around so like mom can get sleep so it's not this compounding. What else should be in like her bag of tricks going into this stage that we all experience to a different extent?
Yeah. I think a lot of it is, I know it sounds cliche, but building your village, but with resources and people that know how to really support you, right? So yes, like stashing meals in the freezer or getting your friends and community to make like a meal train. That is invaluable, right? When you typically don't feel like you have enough time to sit down or eat regularly, right? And these are things that are very hard to have like structured into your day when you have an infant. Um, I think having a friend or two or family members that can genuinely come and either hold the baby while you shower, or, entertain the baby while you get it, 30 minutes of a nap, instead of coming and, you know, holding the baby while you do the dishes or, you do any other things on your to-do list. Genuinely think about what is protective for me during this time that is so vulnerable, right? Sleep is protective. Nutrition is protective. Gentle movement, of course, based on guidance from your doctors, if they give you the go to exercise, right? At 6 weeks, I was not ready to exercise. I couldn't even sit, right? So we're thinking about let's be realistic, right? Even gentle movement, right? Gentle stretching, going outside for some fresh air, taking a 2-minute walk if that's the most you can do during that period. Those are all things that will be restorative for your recovery.
Great lineup. Well, Eva, I'm so grateful for your time today. Thank you for talking postpartum with me. We'll have to do it again.
Yes, there's so much
And
more. And